There was a good understanding of what had to be done. I think the big issue was, could change actually happen on a major scale?
We needed to have a plan, and we needed to have good leadership around the implementation of that plan.
What is utmost of importance to the patient is that you have quality, safety, and you have consistency.
This is a small country. We've got great opportunities to look forward to how we better offer care for our patients.
There are about 30,000 new cancer cases every year. They're, roughly speaking, equally divided between men and women. 1 in 4 deaths in Ireland is from cancer. The overall survival is about 55%, but overall we have the 4th highest rate of cancer in Europe, so we've a long way to go in terms of trying to prevent cancers.
More people in Ireland are getting cancer than ever before. But for many years, cancer patients in Ireland face challenges accessing services.
Patients would, in my opinion, have had 2 difficulties. One was having an equitable way of accessing an expert opinion, and secondly, having access that being guaranteed that the service and the quality of service would have been uniform, independent of where they lived.
The fragmentation of cancer services was a major problem, both from a quality point of view and a patient outcome point of view, but also from the perspective of using the scarce resources we had in the most productive fashion.
Ireland needed a more integrated approach to cancer policy. Following on from the 1996 Cancer Strategy and National Cancer Forums, the 2006 National Cancer Strategy proposed a radically different approach to cancer control in Ireland.
Well, the vision was for world-class cancer services, where fewer people get cancer, and I suppose those that do would have better outcomes.
This wasn't focusing on one hospital or one region. This was a national programme with many different elements.
And ultimately what came out of that was that we were going to have 8 centres with a hub and spoke model to deliver care within 4 regions, such that all patients would get the same quality wherever they presented, anywhere in the country.
What you were trying to do is provide a world-class cancer service with equal access for all. That's a very big vision, very challenging, but it came at the right time. So a big vision, and certainly one worth pursuing.
The 2006 strategy proposed a radical transformation of cancer services in Ireland. The strategy was largely embraced, but some of the changes met resistance.
I was never going to give in on the cancer programme. I would have preferred to have resigned as Minister for Health rather than to have compromised in the area of cancer control, because it would have been about destroying patient care, and I was not prepared to do that when the evidence, the overwhelming evidence, was that what we were doing was the right thing.
Irish people had a history of measuring the success of their local health services as to whether they had a local hospital. And it was difficult then to persuade people that what we needed to do was to move to a smaller number of larger hospitals that treated larger volumes of cancer.
The National Cancer Control Programme, a part of the HSE, was established in 2007 and was based on the Canadian model in British Columbia. Professor Tom Keane was recruited from Canada to manage, organise and deliver this programme to Ireland.
We identified about 6 or 7 major initiatives that we thought could, with the proper support and funding, could be implemented within a 2-year time frame. Obviously, centralising cancer services to specialised cancer centres. That was a big part of the strategy. Obviously, there were other components around a national radiotherapy plan. There was issues around engaging family practitioners in cancer services. So there were a series of initiatives mainly focusing on delivering the best cancer care based on the evidence that exists out there.
The National Cancer Screening Service was established in 2007 to develop quality cancer screening programmes. The service delivers national breast and cervical screening programmes, with the majority of women taking part. Next year, we'll introduce Ireland's first colorectal screening programme.
The cancer screening programs, I think, have brought something unique to the Irish Health Service in the sense that now patients have an opportunity to avail of a preventive health approach, taking control themselves in terms of doing something for themselves in preventing a cancer developing.
Surgical services for breast cancer were the first to be consolidated into 8 cancer centres. The National Cancer Control Programme worked closely with the Health Information and Quality Authority to establish standards for high-quality symptomatic breast disease care.
There was a demand that breast cancer services be transformed. Well, the targets were that every case that was diagnosed as being urgent had to be seen within 14 days or 10 working days. If it was non-urgent, it had to be seen within a 12-week deadline. For us in surgery, if you diagnosed a breast cancer, you had to operate on that patient within 20 working days. And that put timelines in terms of access to care. So the health service had to provide the resources to deliver on these guidelines.
Changes were also made to the way that cancer patients were diagnosed and treated. Multidisciplinary teams would now plan individual patient treatments.
So there's really a sea change in the way patients' cancers are addressed. And probably the core element of that is the multidisciplinary team and the multidisciplinary conference at which all of that data is collated and the plan is developed.
It was recognised that radiation oncology services in Ireland were significantly underdeveloped. By 2011, plans were underway to develop a national network of radiation oncology services.
We have 2 new state-of-the-art treatment centres in Dublin. They will increase the treatment capacity in this region by 50%. We have extremely detailed plans drawn up for the second phase of that development plan. So when this plan is fully implemented, we will have 4 large treatment centres networked with 2 small satellite units running as a single network.
The 2006 National Cancer Strategy has introduced many changes in the way that cancer treatment is delivered. Survival rates in Ireland can improve by up to 10% if this well-organised system is fully implemented.
The biggest concern we have is around the rapid increase in cancers related to the ageing population. The greatest opportunities we have are around centralising our expert services in the designated cancer centres, sustaining not only the human resources but the technology, whether it be surgical equipment, radiation equipment or cancer drugs, so that we can continuously offer evidence-based standards of care to patients quite consistently across the country.
The ongoing reorganisation of cancer services has resulted in better outcomes for Irish cancer patients. Cancer survivors like Rebecca O'Malley had campaigned for a standardised system of cancer treatment.
What is utmost of importance to the patient is that you have quality, that you have safety, and you have consistency. As a patient, you need to know that whichever hospital you go into, you are going to be given the same standard of care and treatment as the next hospital. And the only way to do that is have very clear clinical governance, managerial governance, and that the standards within that governance and the systems are regularly audited, monitored and checked and fed back into the system. So it's a constant upward circle of improvement.
Rapid access clinics for lung and prostate cancer are now in operation, resulting in access to early diagnosis and treatment for patients.
As long as we carry on with the trajectory we're on and we finish the job and sustain the delivery of these services, I would expect that in about 10 years' time we will begin to see the change in survival for patients diagnosed today.
The 2006 National Cancer Strategy set out to transform Ireland's cancer control programme. The journey is not over, but progress is being made to ensure that Irish cancer services continue to follow international models of best practice and develop into the future.
We need to think about health, not just in terms of helping people who have ill health, but we also need to think about health and investment in health in terms of preventing ill health. And I think it's important that from the top of the government down, that we see a focus on changing health behaviours in Ireland into the future.
My main message is that we're only part of the way towards a fully fledged, comprehensive National Cancer Control Programme. If we achieve it, we ought to be able to match the outcomes of the very mature and excellent programmes in other countries, in which case I truly believe that Ireland has the opportunity to improve the overall survival by at least 10% for many of the common cancers.